growing pill mill epidemic and a trial that's making headlines around the country. At the center is Dr. Lisa Zang, an osteopathic physician who wrote more than 27,000 prescriptions in just 3 years. This is the case of a doctor some are calling a drug dealer in a white coat. If found guilty, she could face life in prison for the death of 3 of her patients who overdosed from prescriptions that she wrote. Today we ask, how could something like this happen?
Dr. Lisa Zang worked out of this Los Angeles clinic, where she earned a reputation as a provider of no questions asked narcotics prescriptions. It was here that Dr. Zang wrote more than 25 prescriptions a day. And it was here that Joey Rivero and his college buddies came in December 2009 to get theirs. Pills in hand, the young men drove back to college. 9 days later, Joey was dead from a mix of alcohol and the drugs Zang prescribed. But Rivero's death wasn't the first. Records show over 12 patients who visited Zang overdosed, one in her clinic hallway. Zang has been under DEA investigation ever since 2010, when she lost her license to prescribe controlled substances. But for prosecutors and law enforcement, connecting the dots in these kinds of cases isn't easy. It took nearly 6 full years. But finally, on August 31st, Lisa Zang went on trial for the murder of Joey Rivero and 2 other young men. Zang pleaded not guilty. The defense paints her as an industrious immigrant, naive about her patient's drug abuse.
She was the person who just kept her nose to the grindstone and worked hard.
But the prosecution claims that Zang was fully aware of the harm she was doing.
The defendant was repeatedly notified by law enforcement that her patients were dying on her. During this period of time, the defendant's practice of prescribing did not change at all.
This is a landmark trial. The first time a doctor in California has been charged with murder for prescribing medicine that leads to a patient's death. But this case exposes a problem that's spreading all across America: pill mills. Places where addicts, or for that matter, anybody, can get a prescription for narcotics from questionable doctors looking to make a buck. It's estimated that 15,000 people die every year from prescription painkiller overdoses, and pill mill prescriptions are often to blame. Whatever the judge and jury ultimately decide in the trial of Dr. Zang, the nationwide crisis of prescription painkiller abuse continues to spiral out of control.
Dr. ADI Jaffy is joining us. He is passionate about this issue. He once struggled with addiction and was a drug dealer himself. He turned his life around and became a psychologist and an addiction specialist. These pill mills, they're a serious epidemic. You're going to be hearing a lot about them. Why, Dr. Jaffy, is this trial so significant?
Well, first of all, you don't typically hold these doctors accountable in a criminal setting, right? Sometimes they get their licenses taken away, et cetera. But this is a criminal setting. One of the last times we heard about this was Dr. Murray with the whole Michael Jackson case. But this is not a celebrity case. These are regular people going to their doctor, and we're holding the doctor accountable.
I mentioned at the top, and you were kind to be transparent about this, that you were a drug dealer in your past. You've had a lot of experience on the other side of this equation.
Yeah.
What is going on? Why are people turning to these prescription medications, and how they become recreational so easily?
You know, the unfortunate thing is, look, if we look at human history, people look to change the way they feel on a relatively ongoing basis, and they'll choose the path of least resistance. The thing about these medications is they're relatively easy to get and they're relatively cheap compared to illegal drugs. And then the bigger piece of it, and why this is, I think, so important, is they think they're relatively safe because doctors are giving them up.
Sure.
And so the thought is, how bad could this be? And we know how bad it could be, right? It could be as bad as 30,000 overdose deaths a year, about half of those coming specifically from opiate prescription pills. It's an epidemic.
I think, depending on how this trial goes, it might actually have a major impact on how doctors prescribe. But let's say, independent of the trial, that you have some say on this. What can we do to make these prescription medications, these opiates, a little more difficult for patients to get, for doctors to not prescribe them so frequently?
Well, first of all, I think there has to be some real oversight on the doctor's prescribing habits. If you're not a pain specialist, if this is not the area of expertise that you had practiced in.
Yeah. You know, I've got to say something to everybody here. One of the biggest mistakes we make is asking a doctor for pain pills, pain medications, and then not being surprised when we get a month's worth. It's a mistake, I believe, for someone to get a prescription for that many pills, because if it's that much pain, you probably ought to see a specialist before you're giving that dose. And I've had personal experience friends actually losing relatives because they have been given large doses of narcotics. It breeds addiction and it creates problems not just for the person, but for their family. Today we're talking about the pill mill epidemic and the trial that's making headlines across the country. Dr. Lisa Zang is being dubbed a drug dealer in a white coat and standing trial for murder. Not manslaughter, but murder. Now the mothers of two victims are speaking out exclusively with us. Jody and Lori, thank you both for being here. I know these are difficult stories to share. Lori, I'll start with you. Your son was a patient of Dr. Zang's.
That's correct.
When did you figure out that he was using pills that he probably shouldn't have been given?
Well, he started seeing her in mid-2008. And by February 2009, he asked for help and handed me a bag of empty pill bottles and asked me to take him into detox. He knew at that time that he had a problem and had been seeing her for every month, walking out with 3 different scripts and up to 200 to 300 pills each time.
What kind of pills was she prescribing for him?
She was prescribing the 80 milligram Oxycontin, Somas, and also Xanax, sometimes Opana.
Oh my goodness.
And each time he got scripts for each one of those.
Did he have a problem that would warrant that kind of heavy narcotic dosing?
No, I think what he said was that he had fallen off a ladder, was his, what he told her. But no, he had absolutely no legitimate medical need for any of these prescriptions.
Are these the bottles?
Yes, they are.
Oh my goodness. Yeah, I'll put them here so you can get a shot of them. There's Dr. Singh's name. I see it right there.
Correct.
These are unbelievable. So was your son nervous when he found out Dr. Singh's practice was being shut down by the DEA?
No, he wasn't, because there were so many other doctors that were out there that would prescribe. And Dr. Zang actually told him and his friends which doctor to go to next.
She referred him
She
to
referred him to the next doctor.
to the next pill mill.
Correct.
And is that next doctor still in practice?
He is. He's still practicing today.
It's amazing to me. It's like whack-a-mole. As much as we might search after these folks, it's hard to get ahead of it.
It is. It's very sad.
So as a mom, you're watching this happen to your son. You're watching others go through this as well. How does that affect you?
As a mom, it's very difficult. I will never give up hope on my son. I love him more than life. But it's an addiction that you can't, as a mom, we want to protect our children. It's our instinct to protect them. And with this, you can't. It's like the mama bear that's going to rip the head off anybody that messes with her cubs.
Yeah.
And unfortunately, there's no way to rip the head off of drugs. We have to stop with the awareness, with getting more awareness out there.
Yeah, but we always say that, right? Awareness, educate them. But if we make it easy to do the wrong thing, well, the wrong thing happens. I must say, I knew that your son had been getting prescriptions. I'm shocked that he was easily able to move from huge doses with one doctor to huge doses with another doctor. Think about that for a second, because that's, to me, is a real breakthrough epiphany. Jody says her son had a prescription drug overdose that came from Dr. Zang's office, but he wasn't a patient of hers. So if he wasn't a patient, how did he get access to the pills?
Well, his friends were patients of hers, and they were prescribed 90 Opana in a bottle, Oxycontin, Xanax, Vicodin, whatever they asked for, and they were in and out of her office in less than 5 minutes.
In less than 5 minutes? So why was it important for you to come talk about this? This is obviously a painful event in both of your lives.
Because my son's death was preventable, and all these thousands of lives are preventable through education and through awareness.
And handsome son.
We need to speak out. We need to break the stigma and stop the shame, because we are good parents, and these kids came from great families. They played sports. They were straight-A students. They were cheerleaders. They were in college. This can happen to anybody in any family.
I understand you confronted Dr. Zang. You went to her office.
I did. After my son passed away and I discovered more and more kids went to her and were dying, I realized we had an epidemic, and all over where I live in Orange County, her name was well known. So I started collecting empty pill bottles from some moms and the scripts, and I went into her office and I said, why? After my son passed and his friends, why would you overprescribe all these deadly combinations in one visit? And she said, it's not my fault, it's the parents' fault.
How'd you react to that?
I said, no. I said, you're the professional and you knew better. And she just continued to say no comment.
So no remorse?
No.
So what do you want folks to know? You have the pulpit now. What do you want them to know about these prescription pill mills and the doctors that are responsible for them?
I would like the public to know to stay away from the pill mills, for one, to not keep quiet about this, that parents need to realize that, break the stigma and don't feel shameful and talk about it, because if we all kept quiet, nothing would get done. We wouldn't get laws passed, we wouldn't get regulations, nothing would be complete. And we just need to talk about this.
So this path to addiction that we've been talking about, it is well paved by doctors. We are often given advice to how to take care of, for example, pain that is either outdated or sometimes have been erroneous. And they're overprescribers. They've been out there before, they're going to be out there tomorrow. Again, stunned that it was so easy to replace her role with someone else who's doing the same thing probably. We've got to stop this, and only we have the power to stop it. So Dr. Jaffy, a lot of folks who are watching, I'm sure will be as angry as these two wonderful mothers are. What can they do to prevent this from happening to them and people they care about?
Well, I don't think a lot of people get into this knowing they want to become addicted to medication. So I think you have to watch some things at the front end. If you're going to a physician that will only accept cash payments, doesn't ask you about your medical history, doesn't do a full hour, 45-minute long sort of session with you to figure out what you're there for, maybe even refers you to a specific pharmacist that they want you to fill out the prescription with, those are all red flags. And if you see that, it might feel really good at the beginning to get the drugs you want, but you don't want to end up 6 months, a year down the line addicted to those medications, no matter how much you thought you liked them in the beginning. And so I think that's part of our own personal responsibility to watch out for.
I want to thank you very, very much. I know this is painful to share these stories, but you'll save a lot of lives today.
Thank you for watching. Don't forget to subscribe and turn on notifications so you never miss out on new videos to live the good life.